Thank you to our panelists for talking to us and reminding us about the national support and resources that are available for nurse scientists, for encouraging us to increase the number of nurse scientists that focus on health equity issues and also from diverse backgrounds, and also to remind us about the importance of collaboration with in other disciplines and also with our communities. So thank you. Now we have 10 minutes to take some questions from our committee members.
So Marshall Chin, University of Chicago, and a question for Anne, that you mentioned, like on the slides that had specific NINR studies, there were relatively few, if any, that you could tell, at least by the titles, specifically involved the role of nurses then in the issue or topic. And I can imagine that you need to have a diverse portfolio in any institute, career development, topics that nurses may do or fund nursing research, but especially given the limited budget of NINR, the relative lack of nursing specific interventions or research that would be distinct from some of the other institutes was a potential concern. So could you tell us a little bit more about where then that would fit within your portfolio, especially given like this morning, even though this morning it's pretty obvious there were just tons of really important research questions that specifically would involve the role of nursing in a whole variety of social terms of health and equity topics.
So, excellent question. And as you alluded to, NIH has a budget from Congress of over $35 billion. NINR's budget is closer to $170 million. So we, one of my staff likes to say that of a penny, we get half a penny of NIH budget. So our process for determining priorities and for what we're going to fund is to bring nurse scientists in from around the country, approximately every 5 to 7 years, to form a strategic plan. And from that, we decide what applications we're going to be asking for. So this plan is one that was designed about 5 years ago. And it is, or 3.5 years ago, and it's still being acted on. We should get a new director in the fall, and a new plan will move forward. There's wonderful science that is peer-reviewed that we are unable to fund because we fund some other studies that are equally or better peer-reviewed. So my point is that there's science out there that is along the line of what you are talking about that's excellent, that we don't have the funds to fund right now. So I think that having this discussion and deciding where we want to go in the future is part of, I think we're open. We are open to this. So thank you for the question.
Hi again, Bill Sage, University of Texas. This will sound like a narrow question, but if you could kind of answer it as broadly as you're able to. A lot of the professional silos have to do with license to practice. Those don't apply kind of in the same way to research or to some sort of collective interventions. What do you think about the role of joint degrees and dual degrees involving nurses? What degree combinations might be useful for what purposes? What might these people be doing in the world? A lot of the physician side right now is thinking about joint and dual degrees of various sorts. And I actually teach medical students who have nursing backgrounds. But I wondered if you could kind of think broadly about joint and dual degrees involving nurses and other disciplines.
You know, when I think about your question, it kind of reminds me of a few years back when nurses were getting their MPH along with their PhD degrees, or they were getting the Masters of Science in Community Health coupled with the Masters in Public Health. And I think the degree in public health lends itself to doing this type of work, because even if we were to get our doctorates or our PhDs in nursing, we still need those complement of courses that we see that are included in a public health curriculum. And so I know colleagues who are doing this kind of work, and a few of them actually have their PhDs they've gone back to get their master's in public health to complement their research endeavors because they are doing intervention research. I received my PhD a while ago. I did not pursue a dual degree. Sometimes I kind of wish I would have, but I did have to take courses at the School of Public Health. That was a recommendation of my academic advisor because she clearly stated, Dr. Joellen Wilbur clearly stated that I could not be doing disparities research without having a public health framework. So I'm definitely in favor of that type of mindset, particularly if we're going to be doing work in this particular arena. And there are probably other degrees that would help to complement our work in the determinants of health that are not necessarily aligned with the health professions, but things that would help us to be better scientists in terms of advancing this particular area of research.
If I could also respond to that, I think dual degrees are fine. And we do have a lot of DMP, PhD dual degree programs that are coming out. My scientists actually that work for me at NIH are PhD and advanced practice nurses or nurse practitioners. So that's always helpful. But the point I really want to make is that none of us can know everything. And it's really the team that you put together. So my work is in genetics. I am not a molecular geneticist, but I am published in all of the high-level journals along that line. So I have molecular geneticists on my team, and I know enough to direct them. So I think nurse scientists are trained to be leaders and team leaders, and that they can put together a team of nutritionists, the team members that you need in order to conduct the work that you're doing. So I think we have to make choices on how long you keep people in school, even though I think dual programs can be good as well.
We have time for one quick question.
To that. In addition to pursuing dual degrees, because I can see some of my colleagues kind of saying like, are you kidding? But we have to make sure that there are other opportunities to develop the skill sets that we need to advance the health equities research agenda. So there may be other cognates that we can take. There should be continuing education.
That's where it could
or
happen,
other
continuing
opportunities that will help us to get to where we need to be.
And like we have the summer genetic program at NIH, and those are ways that we help people incorporate these other areas in.
We have time for one quick question and a quick response.
Okay. Hi, Regina Cunningham. I have a question which I wanted to direct at Janice. Janice, great presentations from everyone. Thank you. One of the things you talked about with the PhD, so I think very, very compelling data about sort of the flat line on the PhDs. One of the things you talked about was earlier, so getting people their entry into research degree preparation earlier. Any thoughts? You mentioned a couple of programs on BSN to DNP and MSN to DNP. Anything in terms of innovations around BSN to PhD? I know of at least one model in the country that's looking at that. Are there any recommendations or thoughts that you have about what kind of innovations are needed in order for us to be able to do that?
I recall, I'm going to pull on my own experience. I kind of got hooked on research at the baccalaureate level. At that time when I had my assignment to do the research project, I thought it was asking a bit much, but I later began to really appreciate the opportunity at the BSN level to start looking at research. And not just taking the class, but actually having to do a project as a requirement for graduation. And I will never forget my chairperson giving us this assignment, and I didn't really know anything about research. But when I found out that I could do research on what I was most interested in, which was looking at minority communities, that sort of like set the framework for me to go on and do more research. That laid the foundation for me to do my master's thesis. And little did I know that that was a question that was asked of me when I applied to my PhD program. Have I ever done any research? So I think introducing that and requiring some type of applied research activity at the baccalaureate level, and even when we talk about the programs with our high school students, maybe we need to have nurse researchers going in and being part of that curriculum to stimulate some excitement, because I'm a firm believer that you can't be what you don't see. So that exposure early on is extremely critical.
Great, thank you.
Thank you. Can we give an applause to our panelists?